All right, just to save time and everything, I'm just going to go through all the tests in one video. First one we're going to do is the Kilberg skin rolling test, and we're just going to pick up the skin, pull it just a little bit, and what we're looking for is seeing if there's like any adhesions with the skin as we go through the thoracic spine. He's a little tight right there. We're just seeing if it folds normal, if it moves normal. If it doesn't, that's just a good way for us to say, hey, this is probably a trouble area. And what next we're going to do is thoracic central PAs. So they're going to be done the same way as the other one. We're going to get on the spinous process, push down, go one by one, and assess. And you can also use a pisiform grip for this one too, where you push down. We'll get all the thoracic spine. So that's the thoracic central PA. The next one we're going to do is just the thoracic unilateral PA. And we're just going to come off the spinous process out to the side just a little bit. And we're going to push down. And we're going to assess both sides. And again, you can use a pisiform grip for that one too. I like using my thumbs a little bit better. I feel like I get a little bit better feel for that one, but it just maybe I'm not used to the pisiform grip yet. And you work down with the vertebrae. And this can be used as assessment or treatment. Assessment's grade 1 or grade 2. And treatment, you can go 1 or 2 or 3 to 4, depending on if you want to decrease pain or increase range of motion. Then we're going to go. The next one we're going to do is the costotransverse UPA. What we're going to do, we're going to find the spinous process and go to about 2 thumb links off. And we're going to do a pisiform grip for this one. And I'm just getting that costotransverse area, and you should be able to feel it spring a little bit. We'll come down, get the 2 thumb links, come off. You should be able to feel it. All right. Now we're going to do the mid to lower thoracic side flexion and side bending. So what I'm going to do, I'm coming over to the side. I'm going to brace. So just brace right here. I'll come underneath. And we're going to do this for closing. So I'm going to find it here. I'm going to bend to the side. I'm going to do a pisiform grip, so we'll bend. I'm going to sort of push out and down with that one. So this is if there's any type of closing deficit. I can have him just come on over, and I'll do the same thing. Now for anything that's opening, I'll have him just bend over to this side. Then I can sort of just push up in that direction. I can have you actively do it, so just go ahead and bend over to the side, and I can get that little end range. Or I can passively do it. I'm going to come back, reset, bring him over till I feel it. And again, I'm sort of pushing up with that one. So again, for closing, I'm going to have him come in, find that little area, get a pisiform grip. I'm going to push sort of in and down for that closing. For opening, have him come to the side. I'm going to press it up. And I can have him actively do that motion. Alright, now we're going to do rib assessment. So first one we're going to do is backwards rib rotation closure. So I'm going to come in, I'm going to get underneath the rib, get there at that angle. What I'm going to do, I'm going to push back, I'm going to block that lower rib, and I'm going to see what the top one's doing. I'm going to go segment by segment. Alright, the next one is going to be forward rib opening. So you cross your arms, I'm gonna come underneath and through the same thing. This time I'm gonna pull him forward. I'm gonna see what those ribs are doing. Alright. Next one is lateral rib closure. You want to assess this one actively and passively. Again, put my hand right there at that angle. I'm just going to bend him in. Alright, let's have you do it. Again, that bottom hand is just blocking. Do it again. Alright. Again. Do it there. Alright. So now we're going to do opening. Let's have you cross your arms. Alright. So what we're going to do here, I'm going to have him come in. Again, I'm going to get that angle of the rib. I'm going to open it up. And I'm going to see what's going on here. Again, I got to have him actively do it. So come in. There you go. And I'm bracing him with my other shoulder. Alright. The next one we're going to do is anterior rib flare. So let's bring this arm on top. Alright, I'm going to use his arm as leverage. I'm going to come to the anterior part, find those ribs, and I'm just going to bend him over. Let's see what these ribs are doing. Alright, and that's it.